We are live. So this is Senate Appropriations, and we're continuing our walkthrough in the language in the House passed version of the 2023 budget. And Stephanie, you have a document.
Yeah, so yesterday we talked about back in the, between the legislative section and the BPIC section, S251, which came into our committee and we didn't vote out, and it was a strike all amendment from the House Senate
this has to do with the investment
it's the strike all amendment is what we were meaning to talk about is potentially coming into this bill, and it's a directive to the new Joint Public Pension Oversight Committee to analyze decarbonizing the pension investments. So it doesn't actually trigger any sort of divestment of any sort. It's a directive to the new Legislative Oversight Committee to look at this and then have BPIC and the state treasurer assist in that.
And the reason it came to us was it had the appropriation, and it came in with that big flurry of bills, and so we thought for time constraints that we would just consider it as part of the big bill.
So are the pensioners paying for it, or is somebody else paying for it?
So there's an appropriation here in general funds to do this.
So general funds are paying for it, not the people's pension fund.
But this is with the new oversight.
Yes, and this was a recommendation that came out of the Climate Action Committee to look at pension funds in this way. It's not a new thing.
No, I'm just curious why they need this other than the appropriation. Could they conceivably, once they're set up, could they assign themselves this?
Why not?
They probably could, but
Okay.
they might not in the absence of a directive.
Okay, so we're just giving them some initial.
But this is only directional.
This is only to say, study it. It doesn't require anything to be implemented.
And it says come back with a report in January on
It
it.
says they should look
So,
at it.
And it's not using pension funds to do this, it's general fund. So we held this 75,000 for inclusion for this study, and it ties in. This is more in terms of investment policy relative to goals that have been established by the legislature as part of the climate action legislation. So I think that in light of the genesis of this and the recommendation that we would need to have the language instructing BPIC to undertake this analysis, and we would have to find the 75,000 on our list of one-time general fund.
Who are all the people on the oversight committee? How many are there?
There are six
It's
from the House.
investment. It's not an oversight. It's the pension investment commission.
It's the Joint Public Pension Oversight Committee shall, in consultation with BPIC.
It's me
So it's 6 legislative members, 3 from
and
the.
Jeanette and I think Cheryl and sorry, I thought you were asking who BPIC was.
Yeah. BPIC really is charged with the analysis, and that's what the cost is. But they're presenting the analysis
Because I'm free,
to the oversight committee. The oversight committee is making the recommendation based on the analysis from BPIC.
Where's that going to go?
It would go, so the oversight committee is legislative, and BPIC is just after the treasurer now, so it's in that same section where we were gonna put in, after the sergeant at arms. There's existing BPIC language there, it would come in right after that, or right around that same section.
I would suggest that we
Right around page 25.
insert it there and carry the 75,000. And I can't remember.
Do they really need that much?
Well, then we can talk through, how you might do it, once it's a refined number from BPIC.
If they don't need it, it'll be reverted, Alice.
Or you could do it to the legislature and transfer it over to BPIC as the committee works, it might be, the appropriation is set, we'll put that in a one-time section, but how you do it.
But we don't appropriate to the commission, or is the commission got its own appropriation now?
No, but it's part of the legislature, it's all legislative members, so it can be within the legislative budget.
But this makes the appropriation to the Vermont Pension Investment Commission.
Yeah, the cost is their ability to do analytic work.
I understand that the appropriation, are we making, does BPIC have its own appropriation?
Yes, it does, but it doesn't have any general fund appropriation, it only has pension fund appropriations.
But this would be a general fund appropriation.
And it would be a one-time appropriation.
All right, I just wanted to know that we had, because some entities, we move it through, like the treasurer's office.
So they used to, the
But now they're direct.
Yeah.
Now that we've created.
they're a standalone commission now and they have their own.
All right, so you're a representative on this oversight committee. I would recommend that we move it forward, put in the language, and we will take a look at it.
Yeah.
All right, now you can leave it back.
Now we can fill those other pages away. Aye.
All right, thank you. So we'll insert that in the right place. You've got it?
Yeah.
Okay.
These are.
So now we're gonna move on to, are we down to OPR then?
We are down to OPR, we're on page 36 of the packet, we've been walking through at the bottom of the page.
And we have our first pension oversight meeting tomorrow noon, just if anybody would like to attend, Alice.
Really?
Yes. Okay, so OPR. This is,
What page is that, sir?
Page 36, bottom of page 36.
do we have a problem with all of the regulatory fee? I thought it was just really the policy around telehealth that was the issue.
I think that's the main issue. I do remember the woman from OPR saying that they anticipated putting some sort of OPR fee bill in front of the legislature next year.
So we're asking them to submit a report on or before December 15th outlining how to restore and maintain the fiscal health.
So we do have that, I mean, the question on the telehealth piece is the main, will we be foregoing revenue in the future, the lower telehealth? We have people outside the state that are paying a higher fee now that would go to a lower fee under the telehealth construct and an estimate of what that could be. And does the telehealth fee structure have to come up on that one piece?
Well, I guess what I'm looking at is this is very broad.
Yeah.
And is every occupation within OPR having a problem with fees? And I'm just thinking, how to maintain the fiscal health of the professional regulatory fee. And that's different than look at areas where the fees are currently not sufficient to underwrite the cost. That's my concern is I suspect in most areas the fees are sufficient, but this is written.
Yeah.
How
I actually don't know the cycle of the OPR. We have an OPR bill every so often.
They're every 3 years,
Every
like
3 years.
everybody else.
Yeah.
And the real question is, have they been under the same, that no fees have gone up?
I don't know if that's the case. I thought we had OPR bill a few years ago.
I would only want them to report on what isn't paying for itself.
And I know I know our concern was around foregoing, waiving the fees for telemedicine.
And bearing the cost of some IT systems.
And yes, and so if in fact that's the only problem, this is a office-wide assignment. That's what I'm struggling with, this language here, is how to restore and maintain. And I'm not sure that every area of fee, for example, I don't know, I would assume the fee, licensing fee for plumbers or I don't know, real estate agents or all the other occupations are sufficient. So my concern is, are we making it way too broad when in fact what we're trying to address is the underfunding created by our own policies regarding waiving fees or doing fee reductions?
And
Well, we did change nursing and the way they were licensed.
That was reciprocity.
And it was for reciprocity, but that changed the whole number of licenses. So I would, so I'm interested, I would say I'm interested in, is there any places where the fees that they're raising don't match what the expenditure is, and only report on that?
I think that's really all I'm asking. To me, that's what the intent was, and it was driven by that $1 million shortfall that they identified.
Although I do recall the head of OPR stating it when they were in for their testimony that she thought it was up next year in terms of bringing our bill to the legislature.
Well,
So this it may be unnecessary if that's the plan.
and the House budget did give them some money.
The House budget covers their deficit that's projected right now. What it doesn't address is the potential future from the telehealth change, the sort of the lower fee that we think people will migrate to that are currently paying a higher fee from out of state, and that will put some pressure on the OPR.
Right.
There's fiscal note on that, but I don't have insight into what the long-term IT needs are over there in terms of how well that's supported.
Well, I guess what I'm concerned is, it's just sort of like the heaven and the moon here.
Recent
kind of-
restore makes you think that there's something that beyond.
Well, look, I don't know how many professions they regulate and how many fees, but it's an awful lot. And I suspect most of them, the fees are sufficient to cover the cost. And this is, rather than focusing on those where the fees are inadequate to cover the cost, or our policy decisions have resulted in a reduction in fees, to have the report focus on that. I think we're just trying to skinny down what we're asking them to do.
Okay.
That's
We'll do a redraft. Do you want to keep a section in and do a redraft that is reflecting that?
yes, I think that is what we need. And because otherwise I just think it's asking them to report on
Everything.
everything. And maybe that's what the House intended, but I think it's, this is almost reminiscent of the discussion we had about fees in general, and Adam Grushin came running over to say that's like a monumental task. Okay, so now we're down to the Cannabis Control Board. And this is
They've added the 703 along with the 3 positions into the Cannabis Control Board line item. So they're identifying that this 703 is for the phase 2. So it's the special fund appropriation, the Cannabis Control Board, basically calling out that it's a one-time appropriation.
What page are we working on and what
37.
document?
37.
Page 37? Oh,
Yeah, it's E240, Cannabis Control Board.
okay, thank you.
Where are the special, what's the special funds?
The special fund is the Cannabis Regulation Fund.
Okay,
And so you had other discussions about flowing the money so that we don't have a large deficit built up in there.
it's hard to appropriate funds we don't have stuff. That's all I'm trying to get at.
Young lady, she said the other.
Hello. Thank you. And what's your name?
Taylor?
Taylor, and you're from?
There.
Oh, wow, welcome. Are you having a good time?
Yeah.
Oh, great, thank you.
Stephanie, it says, this act, the funds appropriated in section B of this act include one-time special funds.
And those are the regulation special funds.
Okay, but I'm just wondering, like I know a special fund, but when we talk about special funds, why are they special?
Oh, because they're for dedicated purpose.
Yeah, right.
So they're money that goes into a special fund?
So a special fund is any fund that has a dedicated purpose.
No, I understand that,
Right,
but we're appropriating special funds from a special fund?
No, the fund, so this is referring back to, the 703 was actually added to the line item in B240.
Okay,
And then it's trying to say of the money what's missing is sort of, it should be of the funds appropriated in section B2.
Right, because there's no reference to a special fund, it just
Yeah.
describes them as special fund.
Yeah. I think this actually, if we leave it in, it should be rewritten a little bit.
Yeah.
We would normally say of the funds appropriated to Cannabis Board in section B 40.
Well, that's,
703 is to support the.
right.
Yeah.
Yeah.
But
It's a
we
little odd
understand what the
construct.
intent is,
Yeah.
but you-
We have like, we have a normal, this is quite the normal way we would write that, actually.
but that's in the House version.
Yeah.
All right, so we're gonna just do a little rewrite, all of what we just talked about.
Yeah.
Okay. Otherwise, we do need to make sure that they've got the IT system necessary to support the administration. Since we're, have a lot of work ahead. Funding for the Office of Healthcare Advocate.
So this is we've had this in for several years where we identify of the funds appropriated in B
Yeah.
shall be used for. It is $120,000 higher, I believe, than what the governor proposed. They did add, they did add funding for the healthcare advocate in the House bill.
Yeah, we got the note from.
Yeah, and so they would like to see the 420, that's one-time money, moved into the base. A chunk of that is healthcare advocate money, and the other chunk is the regular Vermont legal aid. And so the ask from Vermont legal aid is to move both pieces, totaling 420 from the one-time tally to the base tally
Well, we'll have to consider that.
in your whole,
Our
your whole
base,
balancing
yeah.
of base at one time. Section E 301, this is in every year. This memorializes our best estimate of what we call sped med, special ed Medicaid is in B sub 1, and then also some other certified funds in B sub 2 that are part of the match structure for the whole global commitment.
We've been doing this for years.
Yeah.
Just certifying. So it's a way of not having to general fund to be on the hook for the match for these services. So I'm gonna close that out because that's pretty standard in terms of
If we have a new
certifying.
estimate, we update the numbers with budget adjustment, and everyone says again what the new numbers for, and we say we have a new estimate.
Okay.
B 301.1 has been in for several years. This is the end of year transfer authority within the global commitment construct. They can't spend more money, but its global commitment is enormous, 1.5 or 1.7 billion dollars, and it allows the appropriations to move around. Some transfers always happen. Some things get in the wrong buckets. Spending turns out differently up and down by the time
But it
goes
still
the year.
keeps it within the global commitment.
Yep, and we get a report. I'm always looking at the reports in June, just to understand what are the big moving pieces there. And then joint fiscal actually usually glances at it in July or September.
At the September meeting, it says. So that's standard, we'll close that out. And B 301.2, this is,
Just to say, we don't know what that bucket is.
the secretary is authorized to seek or extend or renew. That's just a legislative statement that sometimes CMS requires.
I think I think they've always needed our authority to go forward. I think this is, this to seek or extend or renew, it's sort of acknowledging that CMS we expected to be in a new waiver on January 1st, and CMS extended us so that if we're in an extension period for longer than the end of June, the authority covers it.
Well, it's nice.
And then it just strive to maintain or increase the state's flexibility.
Well, that's
So
what we really want
aspirational.
to strive to increase. So that's, what's that in last year?
I think the authority was in last year. I don't think the sort of aspirational language was stated.
Well, I don't know about the other members of this committee, but I certainly don't want to be non-aspirational. So I'm going to suggest we close that.
I'm pro strive.
So
No, Vermont, oh, this
Well, can I just ask,
is, no,
why does this,
Go ahead.
why does this say they'll seek to extend? Because I would think that by June 30th, we want, this is nitpicking, but I would think by June 30th, we want it to be done and signed. And if it goes past June 30th, we would give them permission to,
but it's an extend or renew.
just,
It's just,
We just got an extension, then they,
I think we sought to have it renewed by January 1st, and it was CMS that,
yes.
but we, you know,
I don't think we're seeking to have this extended. I think we're just giving permission to extend it if it goes beyond June 30th. That's my.
yeah. I think we need both, because we don't know what CMS
we
is
could,
gonna
we could
extend it again.
seek to renew or extend.
I
Rearrange
just,
wording.
I don't think the secretary wants to extend it.
Nobody,
They
we would
want
like
to
to, we would
sign.
like to be in a, know what our actual
Yes, we would like to. know
terms and
that.
conditions are.
I think.
Because there won't be money for anything if we don't get that waiver renewed.
Well, our questions yesterday about should it be 3 or 7% all hinge on this or higher.
They were a little vague on that.
They were.
They were very vague on the 3%, on the rationale for that. They
Yeah,
didn't
well,
answer.
but she did say that she didn't think at 7 they'd go over it. So,
Well, do you care passionately enough to?
no,
want to-
I'm just saying though, I don't want him to seek to,
He's gonna hold his passion or some other stuff.
some other thing. But
All
I'm-
right,
I'm
306. This is the same adopt,
This is always just in case there's, you know, a change in the, at the federal level around the exchange that we can.
Jeez.
we know, Stephanie, they gives him the authority to file emergency rules. It's been in here, I don't know, since that,
Yeah. Well, early on in the Obamacare rollout, we needed to be able to nimbly respond, and we,
I don't know why they keep asking for this. They haven't had to use it, but I guess we'll keep it because it might,
Yeah.
we might need it, I suppose.
Yeah.
We can't.
Like a booster.
I'm gonna move on. This is the language, this was the language that was the subject of so much back and forth on the small group and individual, and
Yeah,
we
we had
pulled
to
it out of the
bring
BAA.
we pulled it out of the BAA because people thought the timing was too soon. And I don't know how different it is,
This is
but it's the
20
same purpose.
So usually we heard from the Green Mountain Care Board, saying pull it out of the BAA. We heard it from Blue Cross Blue Shield saying they wanted the language. And we ended up pulling it. So now it's back in, but
It's back in, I don't think it's, we'll take a look at the, I don't have the effective dates here, I don't think, but I don't think it's effective on passage, and then maybe read it.
this is for plan year 2023
Which is starts.
in the fall.
Yeah. So,
Well, if anybody is listening, maybe we should shoot an email to the Green Mountain Care Board. They were the ones saying it was a problem.
we'll follow up with them.
Could we follow up and make sure that if we leave this in, that it's not problematic? In or out? And maybe Anne has got it updated. Okay, so public health, we're on 312. This is the usual language around the allocation of the Ryan White money.
Yes, except that sub 2 is new, above the governor's recommend, this 295,000 is added funds that you'll see when we go through the money in the House side. So I just wanted to point that out.
Is that one-time money or is that a base?
They added it to the base.
You just get an email about that today? Didn't we just get an email about this today?
That was from UVM Medical, and that had to do with
Oh,
the
yeah.
mobile,
Yeah.
and they'd like
yeah,
to
yeah.
provide more support services. So if we close out that section, we're basically agreeing on the amount. I think we may come back to it, I'm not sure.
So we'll,
I think we just have to add that to our list.
we'll highlight that, that's still being on hold.
But we did get something. I hope everybody's keeping track because I can't keep track of all the requests that are coming in. Last minute, give us 200,000.
Isn't that Stephanie's job?
Yeah, I can't.
Actually, I think it's subsection on the next page, is also some new money in there, or new language, the syringe language, I'll double check that.
Oh, for the needle exchange?
I don't know if that dollar amount has changed
Well,
from what was previously.
that dollar amount is different than the dollar amount that's in,
Budget documents from that.
the requests that we got. I've got those and I'll get you, those new numbers.
So we'll highlight that
And it's
section as well.
in two pieces, so.
But Vermont Cares and the AIDS Project, those are things that get money every year.
Yes, mostly yes, that language has been in, and the distribution was agreed upon a long time ago. There was a lot of effort put in to make that work, but in terms of how you allocate the grants and AIDS medication rebates. It's not, the Ryan White is not. I guess,
On page 43, there's a bunch more money for like the AIDS services.
about 100,000.
Yeah, on the page
Yeah.
before.
My gosh, there's a lot in here. The question is,
5 on the page before, and now another 100 over
and
here.
there's another syringe exchange in page 44. Grants of 360.
Another one.
Does that help?
Yeah, I just didn't, sorry, it didn't click with me that was an add-on to the, it must be the 360 and the 200.
Is that all through the
Does that,
department?
does that make
Yeah.
sense to you?
Yeah, so this is new money as well, it's sub 6.
Yep, do you need this? or-
No, I didn't, thank you. Good. Thank you.
So how much is,
So the additional money is in 2 and it's 6, that the House added over and above the governor's rec.
that's the 295?
The 295 and then the 560 that is in subsection 6 on page 44. There are 2 pieces of additional funding above the governor's recommend that the House added
All right, so
in the base.
in the base. So we should be tracking what the House did add to base.
And we do have that on it, we do have that on that long sheet. It is on that, I just forgot about the 60
I
piece.
don't know, all of a sudden I'm getting all these spam calls and I hate to not have my phone on because Gil should fall or something last night. He almost fell. He said he was dizzy. I was like, oh God. You said your grandmother chokes a lot.
Yes, she did. That was what happened to her.
Yeah.
So,
Yeah, I'm afraid we're
So,
experiencing some of the same thing. Coughing, and, oh, I have a tickle in my throat. but-
So the AIDS issue, then that's getting almost doubled from what it normally was.
No, I think some of it was restoring reductions that were embedded in the governor's proposal for 23.
But the 560 isn't, that's gotta be about half of the total.
I think, because they added the language in section 7 as well at the end there about not,
I'm gonna just hold this, and Rich, I want you to, if you would hone in on this section, because it's Department of Health.
Yeah.
and help us walk through what was proposed, what the
Yeah.
House, and what you think.
What's clear is what's over what the governor's recommending for 23. What we need to get you is what was sort of embedded as a reduction from 22 that they're making
Yeah.
up.
That we could, rather than our attempting to do it right now, we'll keep moving and.
So Stephanie, I've got most of it, but it's kind of.
And maybe Maria's.
I think
Yeah,
Maria,
track.
Maria has been working on this, covering that section on the House side.
All right, so now we're at to 314, and this is the mobile crisis outreach. And this is based on that new program that's
Yeah.
coming out.
Is that,
Well,
is
we
this
had
the one
one-
that started in Rutland?
Yes, it is, yeah, and they're expanding it.
And is this the 1.9?
Yes.
Okay.
And we did, this is our language from last year. Comply with federal requirements if needed to qualify for 3 years of FFP. Or we wanted, remember last year, Stephanie, we added language because we wanted to make sure that the programs were eligible for Medicaid match. I think because it was proposed, the way it was proposed was all general fund, or, I don't remember, but we,
So yes, we knew we had the enhanced match for 3 years, the 85%. And we only did the Rutland, which was the start last year, but we asked them to come back and have the,
let's see, looks like a language from last year almost. It looks like what we did. In other words, after the 3 years.
we wanted a sustainable program.
Yeah.
The question it raises though is the 1.9, a 3-year number, does that get matched up? Is that only 15%? Because that's an enormous program then, if that's only 15% of the program.
Well, you want, we should set this
I don't
aside.
think it is. I don't think they've counted on any match yet. But as we go along and design the program and roll it out, and if it matches, then the amount of money of that 1.9 gets offset by what we can draw on that enhanced match for the mobile crisis unit.
Okay.
But my understanding right now is that it's all general fund to start, even though we have the language in sub 3 there.
Let me,
That's one to check to see if there's any potential to save a little base there.
that's what I'm wondering. If you could
Because we're
share
several months further down the road on the development of this.
Do we have any information about, they're expanding this. We did it in Rutland. We have very little experience so far. Is there any information in terms of what has been the experience to date in terms of the outreach, number of individuals, served, what have been the number of calls, what has been the staffing, in other words, we're expanding something that we just started. We've got and I know it's obviously being driven by this new federal, enhancement here. And we're moving forward. Everyone knows in some ways, I have to say, this is reminiscent. Years ago, the merchants in Burlington expressed concern that they saw people with mental health issues on the street, and they could see when their mental health condition was deteriorating. They said, these people are not going to go to the Howard Center, and get an appointment. And we see them, we're concerned about them. You need to bring the services to where people are. And Rod Copeland and I went, and what was really impressive was it wasn't, get the people off the street. They're, not good for shopping or whatever. It was, we see these people, we're concerned because we see when in fact we know that they need help. And so can't you come to where they are? And so in many ways, it seems like this is how many years, 2 decades later, maybe we're saying, we need to take the services where the people are rather than, a desk appointment-based kind of approach. So I don't have any qualm with, the whole concept. But it just seems like, how do I know when an urgent care model, they shall build an urgent care model. I don't have an idea of how an urgent care model fits within that mental health, continuum of services. And I don't have, and when would we have the sustainability plan?
I'm just trying to see if the handout from mental health
Answer
board,
that?
it had any information about the rollout of the Rutland pilot. I'm just not putting my hands right on the mental health budget.
It would be nice to have those numbers though, so if anybody asks, well, why are we expanding this? Well, the other one's busy 8 days a week.
Oh,
And
I think the reason, we know the reason they're expanding this is 85% federal match.
Yeah, but if it's just spending money to spend money.
Let me,
it's,
I'd like to comment on this too.
yeah, go ahead, Vic.
I am concerned that we have a mental health system that's in deep crisis, and now we're adding more to it. Maybe this is a solution, but you have the designated agencies that, can't get people to work for them. You've got a psychiatric hospital that we don't have, and they're asking for more people there. And then I'm dealing with kids in the juvenile system that are clearly with significant mental health issues, but DCF is getting them. And then in the adult system, there's a lot of adults with significant mental health issues, but DOC is getting them. And I would like to see a close examination of our entire mental health system and what it needs and what it doesn't need. Maybe this is one of them, but we're just keep adding because there's, an 85% federal match here. If we're doing it for that reason, we're gonna, you're taking money away from somebody else, that's for sure. So I find this to be a great idea, definitely needed, bring the supports there, but it's a system that needs some kind of direction, and I don't see the direction.
I guess that's getting into my comment about what that model, in other words, what that looks like. The other thing, I got some statistics on the demand for children's mental health or children served, and I can't remember, it was up to maybe through 18 or young adult. And I think it's like the biggest percentage of demand for mental health services were children. And I don't think people register. We've got all this advocacy for kids, and we're starving our mental health system. It seems that we're seeing such a high demand. I was talking, Senator Ingalls was talking about, he got parent calling and saying, I can't get my child in and for mental health services. And he called the director and got the kid top of the line, but he said, that means somebody else is pushed back in the line. And but the percentage of the mental health caseload for really children and young adults is very, very significant. And
supposedly growing during.
And so we're seeing it, as Dick said, obviously children coming into custody of the state. And it has to do with the capacity of our service and if somebody's in crisis, you don't say, I'll give you an appointment in 60 days. And so it's fine if you call and somebody advocates to get you to the, top of the line, but somebody else's child is getting pushed down. And so I agree. I think I think that we need some,
So there is
More
some
information.
There is some information in the documents they gave us for the budget, and it is not entirely general fund. It's actually a $5.94 million grossed up program. 5.94. 1.9 is the match. That's so it's a mix of the 85% match rate and the regular match rate.
But the point is, if you take the workers from your local designated agency in order to staff the mobile outreach services, you're gonna have less staff at we have a system in crisis, and I'm really, well, this sounds like a great idea. It might work. It's like a lot of other ideas. We still have to examine the basic problems of the system of delivering mental health services. And we don't do it. We add to it. We add new programs, and they're great ideas.
I'm not sure, I really, I think sometimes we want to put a new label on something when in fact it's a more effective way of delivering the service. And the way I would look at this is that although we're talking about mobile crisis, to me, this is back where the example I was giving 20 years ago, and that is taking the service to where the people are in crisis as opposed to the office. To me, it's just how you do more differently, how you serve people more effectively. And so if this gets some more resources to help serve people and not just cannibalize staff, as Dick is concerned about, from one to another, then that's good. It would be nice to know how much more capacity this would provide, how we would measure, is this the right investment? I'm like, it's so much of it feels like it's driven by the higher federal match, and that's great to leverage higher federal match. But I think we're really talking about how does this complement what's in place? How do we know what we're getting for this investment? How many more people can be served? And just some basic metrics around what this investment provides to Vermonters in need of mental health services. And maybe their one pager does that, Stephanie.
I don't think it will give you, it states that the Rutland, which was a $600,000 ARPA funded, that's what we did last year, because we were.
That's why we
Because we weren't quite right, they weren't clear on what exactly was needed. It's an evidence-based model, so it's a phased approach starting in 23, so I don't know if the entirety of the 5.9 is the 23 spend, but it should be explored in a structured process with stakeholders. There's the mobile response and stabilization service, something called crisis assistance and help on the streets is the other component.
Oh my God, a novel concept.
And then they
I've
have,
never heard of it before.
the living room model, where you community crisis respite program, where you come into the home. And then part of care for kids piece, but there's not a lot of there's not a lot of narrative that goes with it, it's just bullet points.
So many years ago, we had a kid, child with DCF care, was on the roof of the parking deck in Rutland, threatening to jump. We had a worker over there, couldn't talk the kid down. Police said they needed help too, they were over. And so we called Rutland Mental Health, and they said, you gotta bring the kid to the hospital, we'll screen him then. I said, well, we need to screen him, come to the roof.
He's on the roof.
He's on the roof, on the edge.
So that's an example of the response, come to the office, right?
Yeah, it was, come to the hospital and we'll screen him there. Bring him to the hospital, screen him there, well, it might be a body then.
Mobile unit,
It's terrible.
I could just imagine this driving in a school parking lot.
With the
Yeah, I
mobile.
don't think
Little kids walking out. and
No,
going
I don't
in.
think that's,
I don't think
that's
actually, I don't think you want to, I don't think you want to vision a van, I think you want how the workers do the work.
Oh,
to
it's
me,
not
it
a
means taking the
mobile
service
unit.
where the person is, as opposed to saying the person, come to my office and get screened.
Yeah.
So it's not a mobile unit.
It's
a
The service is mobile
Yeah.
in that
Service.
as opposed to,
Yeah.
thinking
And mobile in the way we traditionally think
like
of
a
it.
mobile or something.
Right, we're talking about 12 grand that, what they tell you?
Well, in some ways, this helps.
600
if
It
we
is to
putting-
bridge the gap in capacity within the designated agencies and emergency services.
Yeah, and so this is one of the pressure points. So when you're talking about the 7%, when you add this, and which is adding workforce and capacity, that does help, I would think. All right, thank you, Stephanie, for looking at that, but I think at some point, we put in money and we're not really good about what did it amount to? And how many people were served?
Right.
And I read the report that public safety did with the embedded crisis worker.
Yeah.
And it was pretty honest, it was too early to really tell, but it seemed like that's the kind of information, how many situations were there called out that really were more mental health and law enforcement? What was the outcome? Was the person directed to service? Was the emergency addressed?
I don't know if we actually put a reporting timeline in with the 600 of the ARPA money for the pilot in Rutland last year. But if we didn't, we could add that, present that with the budget next year, so that you'd be 2 years out on the pilot, you should be able to have some
I
reporting.
want some language.
Yeah,
We are
yeah.
terrible at following up saying, did it amount to anything? How many people?
Yeah, and how is that experience informing this new money?
Right. Yes. I think we deserve that.
Well, I think the people deserve it.
Well,
So we'll
we're
work
making
on
the
a-
investment with the best of intentions.
Yeah. So we'll work on
Okay.
follow-up pieces that would be an add-on to this section.
Oh, wait a minute, what is this one? Oh, this is
The report.
This is similar to what was in the budget adjustment.
This is something that was very important to Representative Donahue, who was very distressed that we stripped that language.
I move we strip it again.
Well,
Which one is the?
this is E.
It's less of a directive.
It's 46, and she said that
314.1, top of page 46.
that language was being developed with the involvement of the hospitals, and that they were okay with it. They were even happy, they could accept what was in the BAA that we stripped out and felt that was adding. Not only did they end up as a default of care, but then we were giving them an assignment to
use the rates.
to use their rate system to make improvements, to deal with people that they were never, prepared to serve anyway.
It is a little weird that it says regarding the progress of the healthcare system in improving the patient experience of care for individuals encountering lengthy. So in other words, not regarding the progress in getting rid of the lengthy waits, but improving the experience while you're having.
In the
lengthy
emergency
waits.
room, while you're in a
Like-
crisis.
The lengthy wait is the problem, not patient experience.
Right.
Well.
Boggles my mind that we,
Right. What, Dick?
it boggles my mind that we would do a report on the hospital emergency rooms, which are stretched thin and are forced often to take people for a longer period of time because there are no openings at, say, the retreat or at the hospital or whatever. And we should be looking at why the system doesn't have the beds to get these people out in a reasonable amount of time, rather than looking at the experience for them staying in the hospital for a long time. The hospitals were never, my hospital was never designed to have people in a emergency room, mental health room for longer than a couple of days. And now they're extended for long periods because of the lack of alternatives within the system. So we're asking people to improve what shouldn't be happening.
Right.
All right.
I don't know if
have
that
a-
made sense, but that's where the problem lies, is what are the alternatives?
Well, then maybe we need to expand this and along with some kind of in that report, why the reasons for prolonged stays. Maybe we need some more data on that, but Rich, do you have a comment?
We know the reasons. We know the reasons.
Because they don't have the step down beds.
That's right.
But go ahead, Rich.
This is all mental health, right, in the report. This is about the emergency room in the hospital. Where are the hospital participants in doing this?
Well, you remember, we had a little a visceral response to the original, which was putting the burden on hospitals. And we said, wait a minute, this is being created because of the lack of capacity, and the burden should be placed on the mental health department. So this is now doing exactly what we said. Mental health needs to take the lead.
But they need,
I think in improving the patient experience and reducing, maybe we should put something in and reducing mental health and reducing
well,
length of stays.
I think that mental health needs to consult with the hospitals and not just tell the hospitals too. Part of the reason that I sat there and I totally agree with that is we're doing it to the hospitals instead of working with the hospitals to come up with a solution.
I don't think we're telling them. It's
No, but before, when they put the language, it was doing it.
and use your money to improve it.
Yes, that, and that's what I objected to before.
I do think even if we let this go, we know that certain things, and actually hospitals are making improvements. They're trying to get rooms, they're getting rid of the distraction, the noise, the lighting, and they're doing it because they've been put in that position. I think to put this in without some a reference in the report in terms of efforts to reduce the length of stay on the part of the department, it's getting to the concern people are talking about, and that is the experience. It's greatly influenced by the fact of whether you're there for 48 hours or whether you're there for 2 weeks or 6 months. So maybe we can think about some additional language that the report that mental health will provide us would include not only while they're there, where they can make improvements, but also how what strategies there are to reduce the length of stay.
The number one thing you can do to improve the patient experience of care is to reduce the stay.
Yeah.
So.
And that's true of all healthcare.
It was
You
all.
If you're in there for an operation, the quicker you can get out, the better off you are.
The other issue that came up at the hospital in Randolph had to do with the sheriffs also, because the sheriffs weren't available to when there's an opening, I think I mentioned this before, at the Brattleboro retreat, they had a patient at the hospital there for a couple of days. Finally, there was an opening at the retreat, but by the time they got the news that there was an opening at the retreat, the sheriff would have had to come at night, and the sheriff was someplace else, so they then lost the bed and started all over again. Well, the sheriff couldn't
Was
transport
that the
it.
one where the retreat wouldn't accept patients after a certain hour in the evening?
Yes, yeah.
And then, of course, the other thing that really irritates the hospitals is that they have no refusal. And so we can have an empty bed at the psychiatric hospital, and the federal rules can say we can't accept that patient because it would be disruptive to the treatment of the other patients. So they end up being disruptive, but it's in a different place. So there's a rule around it, but if you're the person working in the emergency room and you've got someone who's in a mental health crisis or is assaulted or whatever, it's not consult. And then the other is the review for admission to the psychiatric hospital occurs late in the day, gets late in the day, which means automatically the hospital has to, provide, keep them until the following day.
And whether the patient will agree to going voluntarily to the next step, like the retreat. If they don't agree to go voluntarily, then they have to go through the whole involuntary admission process.
So this is something the hospitals and staff in the emergency room have been talking to us
for
about for
years.
years. And I do think that the agencies are working to put in step-down beds, crisis beds. And so I think since we're making the Department of Mental Health responsible, I think we should also have them report on the progress
On the progress, yes.
and reducing length of stay and reliance on emergency room care.
Right. that's a
If we
good
can
one.
add something like that to the report, I think that would help.
Yeah.
Got that, Stephanie? She's making a note and checking it twice.
Yeah.
Okay. Abby, do some of
Progress.
this.
We'll take a draft of it and circle it down.
Yeah, okay.
You know what progress really is? You called the head of the mental health agency, which is what I did several times on this one person that kept winding up in the emergency room, couldn't get moved out. And he got, I forget, he's gone on to another job. What was his name? An Indian name,
Oh, Morning Fox.
Morning Fox.
Uh-huh.
And call him and say, okay, I'm on it.
Yeah, Morning Fox now works for public safety, and he heads up that whole program around embedded social workers, mental health workers.
Oh, okay.
And to me, and remember, we told the Department of Public Safety out of their budget to fund those positions. We didn't put any more, we said, fund them. And then they come back and hired Morning Fox, which to me is a very good indication of how they value the need for those kinds of services and
Resources, yeah.
expertise. Because so many of the call outs are really mental health, not law enforcement.
I'm sorry to see him go because he was a resource.
Yeah,
But I mean, obviously. he
But
did
we
a great deal of
don't
research.
hear, I mean, just hear good things, I don't hear anything from that issue anymore.
No,
It's pretty well,
I think they really do
Get
fine.
calls at home.
Yeah, I think they do fine. All right, so, but that's an example where that person got dealt with because somebody got hold of you and you went to the
That's
top of the line,
Right.
which meant somebody else probably got pushed down. So now we have a report on childcare financial assistance.
This was back in 2020 when we did the big step up and they want to report back on the
But
effectiveness of
we're,
that.
what, are we 75, with this 75% of the way the funding in the system?
You also have this concurrent report on the financial part of the system that JFO is doing, and we're in the midst of, hiring that contractor right now. So I'd like to circle back with Nolan and Joyce on this
I
particular
really,
language to
well-
see how it works with that
Well,
other financial report that's
it-
coming out.
I would like to sit down with you too, because you're also in here completing the associate credentialing at VTC. One of the things that I will want to add in here is we created that program at the technical centers. And that
To
there
be a
isn't,
pipeline.
to be a pipeline, and there isn't money in this budget for that. But they have 17 placements filled with that, and they're having good luck spreading that out. After 1 year, they've got 17.
Who is they, VTC?
No, this is with the technical centers.
So many technical centers rely on VTC for the curriculum development and then they provide it
Right, they,
at the
so
center.
I want to figure out how this all fits together.
I want to know, it seems to me you need, you'd have to contract, how you would evaluate how programs and expenditures set forth in the 2019 Acts and Resolves contribute to Vermont's children and young people reaching their potential pursuant to 3 VSA Section 2311. What kind of an evaluation? It seems to me that's a very complicated evaluation. And first of all, how the programs and expenditures contribute. There's so many variables, and unless you had control groups, to me, an evaluation is a very, very structured, disciplined look at, and with established criteria that you're measuring against. So what are we expecting here? And reaching their potential. How do you even define what's potential? Success in first grade?
What's 2311? What's in that section?
I don't know. But am I the only one? How could you write that evaluation? How would you do that evaluation?
Well,
Normally it's inputs, X number of kids were in licensed centers and, 3 stars, 4 stars.
it's like that restorative justice study that was put in. A lot of these have this philosophical dimension to them where they're asking, for like a spitballing session, like sit down and think big about this issue rather than look at and evaluate the data and tell us.
The reason I would support taking this out is the term in consultation with stakeholders.
Well, that you're way back. I'm already down to 3. You're on A, right?
Yeah.
So
Well, I think, and I know you're down to 3,
October.
but I think it's
It's out a ways. It's also, you have concurrent reports that haven't come out yet.
Right,
So
and you haven't finished producing all the money for the new funding system to be in place. So you're only,
Who wrote this?
well, I don't know who wrote it, but it was probably directed to Katie from somebody on the committee or somebody from another committee.
I mean, I obviously want to make sure that we're spending our money effectively, but
can we put this on hold? I'll sit down with Nolan and Katie.
And line it up with
And I do
Joyce
wanna-
there as well, because we have that, we're in the midst of the RFP for the financial piece. And I think the contractor that we end up with
And
that will be very helpful in sort of framing things.
And the piece about, this is October of '24.
I understand, but this language now is sort of putting the parameters of what is the report and evaluated, and I'm like, how do you, what will be the criteria for young people reaching their potential?
Well, you'd have to have
A lot of
good
times,
guess.
people don't fully realize their potential until adulthood. I don't know.
They don't know their potential until
And I
they're
don't even-
60 years old.
I don't know what it, it used to be success by 6, used to be, and the argument for those investments, it would reduce the need for special ed services. And all we've seen is the increase in special ed costs, so.
Well, and it's not even necessary because in the one above, it says evaluating how the programs and expenditures, evaluating them and deciding whether they should continue.
I know.
So if they should continue, you're implicitly saying that they're helping young people reach their potential or serving young people or
So it's
contributing.
even out of sequence is what you're saying. You need to evaluate in order to determine whether they should continue?
Well, I just don't think if we're gonna keep it at all, I don't even think you need 3.
Well, I think, all right, Sarah Westman says he's gonna take it. I think we certainly need to know, we got a lot of communications about the importance, and we need to have something I guess there has to be an agreement in terms of what are the metrics to determine effectiveness.
Right.
And if you're gonna do that kind of evaluation in a structured way, you've got to start out with agreement on what you need and how you define it, and what kind of data would you have to get in order to make a determination. This is a lot of language that if you go to say, what does this mean? How do we administer it? What do you need for resources? Do you have to hire a consultant? Do you have the data systems that collect the data? Those are just some of my thoughts about what's being asked here.
But 2311, VSA 2311 is the Chief Performance Officer Annual State Outcomes Report.
Oh, thank you for a lot of that. The auditor's office kind of looked at some of those outcomes, and GAC measurements and felt that they were so global, they were hard to use as a framework.
I'm pretty sure next year's budget, with given the 2024 number, there, somebody will rewrite this again in next year's budget.
You know, I just don't want to give assignments out.
So I'll try to find out from Maria and Sarah.
Sean
what the-
Brown has got his hands full and his pants to hold up. He doesn't have a replacement for the juvenile facility. He's got a child welfare system that's in fragile state. And he's got reach up families living in motels and money that it's probably gonna be clawed back because of the ARPA, that whole, the rental ERAP. And so if we're gonna ask to have a report with the complexity that's here, then we ought to know what it is, why we're doing it, and the resources it's gonna take to carry it out. And so maybe the discussion with what the consultant's gonna do will help us here.
To frame how you.
But I just have this personally, when I've been on the receiving end of something like this, is like, where are your priorities? What do you want me to do? How do you want me to do it? What do you intend? And I'm struggling here with how you would execute this in a way that would give us something actionable or help us validate that the money that we put into this system, kids are being well served.
So it looks like it's the House Committee on Human Services and the Senate Committee on Health and Welfare, where it came from. House Committee on Human Services.
How do you know that?
Getting the report.
That's who gets the report, but I don't know who did the writing.
Hey,
Who
you're
did the writing? Did you
hiring
revise this, Rebecca? I did not. Where'd it come from? An advocacy
It
group?
probably came in the letter from House Human Services to the committee, and it was probably asked to be drafted.
You don't know.
I do.
Well, tell us.
I'm 99% sure that this is old language that is carried over from when Act 171 was originally passed. And this was put in when you put in money to allow for a study. I believe this language you've seen before, and I believe it was written by lead counsel. That would be my recollection, but we'd be more than happy to work with your staff to make sure that everyone has the history.
Okay, the drafter is probably, I'm
I'm
pretty
sure
sure
the
it has to
drafter,
be Katie.
yeah, but Katie doesn't dream it up herself.
My colleagues would be more than happy to work with your
Well,
staff.
I hope you understand, it isn't because we don't want to get a good evaluation. We want to have something that's tight. We want to have something that will give us some affirmation.
We're hiring a consultant now.
Or hiring someone on the financial side of it, but these are talking to the investments that were made in the past. So, and part of that,
Well,
the
no.
cost structure model that they're gonna build.
These aren't just the past, we've got money in this year's budget to
Yeah.
use to 75%. We haven't, we set a path out.
Yeah.
We haven't come to the end of the funding of the new.
Yeah, it's a,
And so this is kind of like before we get everything.
I'm sure we'll get a lot of emails from people that are listening, but I do think if we really want to do a robust evaluation, then I'm not sure this is gonna be it, yes.
So when you guys passed that child care bill a few years ago, this was in there, and the idea was that you would truly understand what was happening. You know, like, I don't know if you remember, the governor put out this 5-year redesign of CCFP. That is where this came from. And so,
The question really becomes one, now that we're looking at it, is how you would actually do it. And that large childcare bill, we didn't go through it in the same way we're going through this budget language. So maybe it just got imported, but if I'm gonna give this kind of assignment, I think we need to tighten it up a little bit.
But I'm confused. If we had it before, why do we need the language in again?
I don't,
the administration Yeah, it's, remember, it was this was the administration proposal to do the redesign. So I don't know if they've done it yet.
All right,
Well-
I'm gonna suggest
Sort of
rather
lay it
than.
out over time so you can understand what's.
I think also we need to, and Rich has had conversations with who's the current director of child development?
Oh, I can't what her name is, but.
Deputy Commissioner Gray,
Yes.
Miranda Gray.
So why don't you take,
I'm gonna sit down.
you've got quite a long list there, Sarah Westman.
Yes, I know. Start coming in the morning.
And I'm just saying, if we're gonna require an evaluation, we need to make sure that we're kind of giving a framework that is.
And having it, understanding the other pieces of the
Yeah.
landscape that are happening at the same time.
And that's the problem when you start looking at stuff and you say, what does this really mean? How would you evaluate? And really, to really evaluate, you need control groups, but I don't think we're gonna get into that level of evaluation.
I'm just gonna say, given this day, they aren't gonna work on this evaluation, not this coming summer, but not till the summer after will they start. This is in October of 2024,
2 years out from this October.
2 years out from this October.
That they have to complete the report.
Yeah, or
And you,
Right.
you had a pandemic in the meantime.
they are gonna do this over 2 years. They're gonna do it,
2 weeks.
they're gonna do it in the summer of
Why is it?
24.
But let me say, in order to do the report and to evaluate, that takes, you're gonna have quite a lot of work here in terms of what you
Yes.
need for data, what kinds of, programs and expenditures, and you've gotta look at the different programs and the expenditures, and then you've got this self-actualizing statement, that young people reach their potential pursuant to a statute. I don't know. They're meeting. Stop laughing. We shouldn't look at this stuff because but I want to be sensitive to what we're asking our administration to do and the resources that we are committing to get something. And I am very jaundiced that so many reports that we get, nobody reads. And
Yeah.
we have to be sensitive that it's no more, when you're committing staff resources, it's committing money.
And I don't think if you eliminated every report this session, you would do anybody any harm. And all the new reports that we're calling for, and I just feel like it becomes a reflexive move. And granted, you want to have information about how your statutory additions change the state of affairs, but I think you can get that by calling in the agencies and asking them to tell you. And I have to say, in the other body, it's every education bill that we ever had come over from them had 5 or 6 separate reports, and we would routinely eliminate 3 or 4, and nobody ever, we never had to explain ourselves a year down the line when a tragedy occurred because a report hadn't been asked for. So.
No.
And, you actually may not change a child's potential, but if you're able to stabilize and provide childcare while the parent's at work, that may be exactly what you want the program to do. So if you're looking at it from the adequacy and the continuity of the service, as opposed to the individual child getting the subsidy. So we
I have
one
a
more
much more
comment.
important,
What is it?
I believe, in the next one.
Oh, no, is it a dangling preposition?
Capacity building should be hyphenated. Otherwise, people are gonna think these are building grants.
What line are you on?
Where are you?
Section E, 318.1.
So,
I'm surprised the editors didn't catch that. They hyphenate up lots of stuff that we do.
this is,
You're on, you're 318.1, you're even on the heading.
Yeah.
That's as far as we've gotten. We're gonna move on. Rich is gonna redeem us and get us a report that, yes, helps us determine, did our money, make a difference? All right, so childcare capacity building grants with a hyphen.
So, the. Today, I need to sit down with Kimberly and talk and see this, because the second half of this is all about STARS. And they are putting STARS on hold. And they're reevaluating over the period of time that STARS is on hold, whether or not they're going to continue to keep STARS as it is, or redo the whole program. I think the intention within the childcare division is to redo STARS in its entirety, to make sure whether it or not it's working. And they have caused somewhat of a firestorm in the House.
Well, how can they know whether it's working or not? They haven't evaluated the programs and expenditures.
Well, I think they made the decision that it's not working.
Well, on what basis?
I think I'm telling you what the childcare division said, and it's been difficult to understand exactly what they were doing. They had a memo come out last Friday, the first time that they really highlighted to anybody what they were doing. But they are over this year putting STARS on hold. So I'm not really clear where this language fits with that.
Well, that's very interesting. Or I'm back to the child care assistance report, because basically it seems like they make a determination that that whole STAR, which had been the focus and reimbursement, was tied to the number of STARS and the funding. So it looks like, in fact, they've already evaluated how some of the spending.
I think they have in the child care division, because they are taking, they're giving the evaluators that are for this, I can't remember who does the evaluation. They're terminating the contract for the evaluators for STAR. They're bringing in-house the evaluation. So if you think that your situation has changed, you can, for the next 6 months or the first 6 months of the budget, stay within the STARS program. But basically, unless you make a specific appeal, they're putting a moratorium on STARS to come up with recommendations out of the child care division on how to change.
When that STARS was all tied into credentialing and
It
education.
absolutely is.
And all of it, that was supposed to be the holy grail.
Yeah, it absolutely is, but it is.
It isn't working.
It isn't working is,
Because of labor force issues with the.
Yeah, I don't know what it means not to be working.
I think it's been hard to get information out of the child care division on this, but I'm just reporting to you what I know of what they're doing. And I think the first
Do you have a copy of that communication that went out Friday that you're?
I have a copy of that communication that went out Friday, but that's the first thing that has come, that many of the advocates and many of the people in the field felt like they got information that they could understand, to be able to understand it. But I know House Human Services has been looking at this, and they've had trouble getting information. What are you smiling about over there? You got more information than that?
No, thank you for that.
Is that about what you guys have heard?
The whole STARS
I don't know.
program.
We
was
don't-
set
I don't think, we're not taking testimony on,
No, I didn't.
so we're gonna keep going. Childcare capacity building grants, and this is infant and toddler, which we have been our priority. So 800,000, is that,
That's what we put in.
has that been the standard amount? Is that the governor's recommend?
We put that in as,
Years ago.
one-time money.
No,
we carved it out.
Did we carve that out?
Have an allocation in the base
Yeah,
for it.
okay.
And so this is, and, because we really knew the pressure was on infant and toddler care.
It still is.
Well, yeah.
But
If your
what-
kids could only be born, 18 years old, it'd be handy.
So it's mainly 5 and the stars reference and sub C is on hold in this section.
What?
Yeah.
It's sub 5 about the star system.
I think so,
Reference to
I think so.
stars.
The question is
But the rest of it, I don't think you.
No, I think that's fine. So we'll find out what happened to stars. Maybe we'll move on to another planet. Okay. All right, so we'll hold that. You've got a lot of work ahead of you, Senator Westman. All right, placement of a child into a qualified residential treatment program.
We're gonna do away
I
with
think
this.
Richie should look into this.
We're gonna do away with the STARS program, and then we'll send the kids to a treatment facility.
Should
That's
this be under the
your
family
age,
service
right?
section?
No,
of
that's
the
my
child care section?
seat number.
Yeah, it really, it's,
It is.
this is family division, this is child welfare.
Yeah, move
Is
this out of the child development section and back into the family welfare.
This is really policy. Dick, you want to take a look at that, into a residential program? That would be like 204 Depot.
Yeah, no, I think that, I don't know where this came from, but I don't even know if we have judicial masters yet. So I think it should be looked at by judiciary or health and welfare. But we already have hearings, so I don't know what.
So I'm wondering, is this adding, in other words, in order to place a child at 204 Depot, this looks like within 60 days, you would actually have to take that case back to court for review. Does
Yeah, I
it
think
work?
we already have those
Workload of the
requirements.
court.
Court doesn't have a say in placement.
No, they don't. The
Right,
courts have
Dick?
never had a, never can,
Decide.
make a, placement order.
Right, they have 6-month reviews, but the 60 days could be,
Unless I just try to-
yeah, somebody should, either health and welfare or judiciary should look at this.
Well, I think so too, because you're asking the court to determine whether that placement is appropriate and whether they could be met with family members. That's almost requiring, that's what
Yeah.
caseworkers should be doing.
That's right. This is another review of what they've already got going for reviews.
If the placement setting is not appropriate,
I don't think we have a problem in terms of placing kids in residential placements that don't belong there.
Right.
my only, I'm not aware of it either. And this really is policy. This is not, this is to put in a budget bill. I don't know where this came from either. So Dick, can you take the lead on,
I
Yes.
will,
and I'm wondering what.
Stephanie, will you send me a memo on this? And I will have Peggy put it on the calendar. I just, for
Cut and
next
paste
week.
that section, cut and paste that section and send it to Peggy.
You bet.
Yeah, the other question is, I wonder if there's been, obviously there must have been testimony by one would think by court administrator or Judge Zone.
Yeah, we should probably send an email to Judge Zone and to Commissioner Brown for a comment on this section.
That's what I think would be a good idea, to make sure that they're aware of it. Because it really is putting additional work on the courts.
Yeah.
And
Yeah,
I
they're
don't
already-
ever remember judicial review of residential placements.
It says treatment program, but I think DCF has to do a review anyway. I know because 204 Depot is now short-term. They have to do a review if they stay, I think, even more than 30 days.
Well,
We need to hear from DCF.
we need to, all right, so thank you. You'll see if your folks in judiciary, we can get some comments back. So we'll hold that.
If you send me that, And there was another section judiciary was supposed to look at too, Stephanie. If you could just send me
That's the restorative
those
justice.
two sections and I'll put them on.
That's what we deleted, right?
Yeah, but they were gonna look at it just to see if there was
Oh.
a.
We were gonna look at that one too, the working group.
Oh,
Yeah.
Is that what I said yesterday?
oh,
Yes.
yeah. Oh, to see if we wanted to do
Something different.
something different or just delete.
I was-
Okay. We like delete.
The
The-
committee is happy to make recommendations, but I just need to be reminded of what it is. So as long as Peggy and I can put it on the agenda and get Commissioner, on this one, I think it's simple, just Judge Zonay and Commissioner Brown, if this is something they need.
Yeah, well, that's, I think that's. the
Wondering if
first-
the Families First program requires this now.
I don't know. I don't know. Well, we can confirm that and see. No, it's kind of an odd place to put it.
The placement in a setting described is not appropriate. My goodness.
Well, and you know, sometimes the placement isn't appropriate, but it's the only one you've got.
Right, that's exactly the problem. We were just talking about with emergency rooms.
Yeah. The court shall determine whether the placement is appropriate.
Yeah.
That's,
That's out of line.
yeah, well, it's certainly a change from past. practice.
Alice, remember those 6-month reviews we used to have to do?
Yeah, they're still there.
Yeah, and that's what this is, I think, and just doing it
They
every
may
six,
just have had a review the month before
right.
and decided that the child needed a residential placement. So why would you review it again?
Well,
I mean, it
I,
would be
I
different
agree
for
with
us,
Senator
right?
Kitchell. This is a policy choice and it should be at least go through the policy committees.
Okay, let's go to GA now. Funds may be used as defined by rules. General assistance housing.
As defined by rules, does that mean rules for vulnerable populations? What rule does it refer to?
We're having the rules being set up on the transition from the FEMA to the ERAC program
Yeah.
right now. And then
Do we need this?
it doesn't, I don't
I don't know.
think it would happen anyway.
Well, that's what I'm thought is, you know, that they can use the money we're appropriating.
Consistent with their rules.
And the rules have to be approved by LCAR, so
So that's
I don't know what that
That's-
achieves.
Yeah.
Let's take it out and see if they notice it.
Okay.
Well, I don't know what this means. Basically, it says you can use the money we give you for the purposes we intend, consistent with the rules.
Yeah.
Which is standard practice. That seems circular. All right. Well, then somebody in the house is observing, they can.
I think a circular file is the best place for this section.
All right, now we've got
Especially
housing,
music.
adverse weather.
I got a paragraph.
Aren't all these things in place already?
All the way.
Yeah. Well, adverse weather, don't you remember the House a couple of years ago wanted to get rid of that,
Yeah, no,
put people out?
have a freeze on a park bench.
Right. Well,
I think that's
isn't
fine.
this standard? I mean,
That's
What's going on now?
what?
Isn't this also something that is currently possible without this language?
Yes,
Yeah, but I
it
think,
goes on now.
I think this has been in there before.
You mean,
Why do we need to deal with it again? It's already what they do.
Because I think it's been in section one before.
Oh, so it has to be in every year.
Yeah, I think that's what,
so why couldn't we just, well,
It's gotta be in there general.
why can't we just make it the policy going forward and not have to? go through
Well,
the-
it's kind of an expensive policy, so.
I suppose, but if it's adverse weather conditions and appropriate shelter space is not available for a limited duration, how would we not subscribe to that policy?
And I think we have it defined underlying.
You think?
I think so. I'll check with Sarah. The timing, I think we have
Maybe we should have Ledge Council, Katie should look and see what we already have got provided for in rules and or in
Yes.
in statute, because adverse weather is certainly not a new topic here. Particularly after we said, no, we weren't going to let people.
And I can't remember in next in E 326, that's
Oh, wait a minute,
standard too.
But what about expedited crisis fuel? That's standard too.
Yep, that's
Yeah.
standard
Yeah.
too. All of these are,
We'll just keep, these are okay. And what about the 12.6?
That goes out to the homeless shelters.
Homeless assistance. This is emergency solutions, grant funds. What are federal emergency solutions? Is that ERAP?
No.
What is emergency solutions?
It's a grant line, I think through HUD or one of the others. I know they were bumped up in
Yeah.
CARES Act and ARPA.
It's a federal,
It's a federal grant line.
yeah, okay. But in ARPA?
The baseline was bumped up in ARPA, and I think it was also bumped up in CARES. We have it on our, how much Vermont got in the bump of those, but I think there's an underlying grant line program. I just don't know what the baseline is off the top of my head.
Okay, is that consistent with what the governor recommended? You know? Do we have the web report that would show that?
Yeah, I don't think they made any change in OEO. Let me take a look really quickly. Except for the volunteer tax.
That was the only change?
Yeah.
So,
So that 12 is the same number that would have been
Alright.
included in the.
weatherization, that, we always do that for the heating.
Oh,
For the
for the replacement
replacement,
of the-
that's standard.
That's standard.
All right, 329 developmental disabilities.
These are the 5 positions that they were talking about yesterday.
So, they tell me, and I'll have to come back. They did not take the positions out, they just moved them within the.
Right.
And so I need to, and this was a move recommended to House Appropriations by the member from Waterbury.
Did we,
So they moved them from the long-term care program.
we
to the-
created them, and are they in the long list of positions?
They're
created?
one list of they're created and they're simply switched over from the long-term care to the PS program. And that's what the objection was from Gail.
Seems like they've got an awful lot on oversight on a system that's falling. It's so fragile.
That's the stars. You know, on Friday.
Okay. I feel a little sorry, we're gonna put all this money on oversight and we've been concerned about the level of it. But when you're not even giving the facilities enough money to underwrite their cost, it seems like we're starving them on one end and then imposing more regulation and oversight on the other. And I kind of have a hard time thinking about, because the residential care facilities really are struggling in all our areas. The one in Craftsbury we usually hear from. And so they, I guess maybe you can say with a 7%, but they've got fuel, they've got food, they've got, workforce.
But, and I need to go back, because this is only one conversation with them about it in that piece. But they did make an argument that because they only review once every 2 years, some of these things get very old before that. And there is, that a lot of the cases around this are so old that it's hard to correct this. Because it's so long.
I understand, and it has to do with staffing. It's just, at this point, should the priority be helping facilities meet their operating costs to provide a decent level of care? as opposed
Well,
to
and-
more oversight.
And they make the argument that as the acuity level of the people that you're taking care of become more, a group of them become more,
Then that costs more too, but they're gonna
Yes.
give them more oversight
well,
because they need it and deserve it.
and but you're getting people that, are more at nursing home levels in that. So it's a complicated piece. It's not simple.
No, but maybe 10 at one time, yeah, that seems like a fairly significant
Well,
infusion.
I think that it, in total, and my mind may be wrong in what they took. And I may have heard it wrong. I think it was 6.
Well, if you look on page 14, you've got Dale's positions. A non-clinical manager, 3 nurse surveyors, 1 administrative assistant, 1 quality outcome specialist, 2 adult investigators, and 1 public guardian financial specialist,
But that's,
and 1 public guardian assistant director. So they're adding more bureaucracy too.
Right.
Not just out
Yeah,
monitoring the care.
So none of those titles exactly match up with what they're saying to redirect here.
And that's their problem here.
yes.
We're creating a position and then assigning them up to.
Yeah, they don't like the reassignment, but at the same time, the reassignment doesn't match, who they're reassigning doesn't match up with the titles that are created.
So they're reassigning positions that don't exist. I mean, title.
Title wise, yeah.
That's part of the confusion in all of this. And this was done on recommendation of Representative Wood.
What, I'm sure of that. I just, you know, that we hear very routinely from these homes about what,
Yes.
on what a shoestring they operate. And so this is a fairly significant,
It is.
So are we talking about these positions for the DS quality assurance? Or are you talking about the res care over in the long-term care side of the world?
well,
Or both at the same time?
aren't they, that's
Because
what,
the 10 was the bureaucracy on the long-term care, you know,
Right.
right.
side, and they're reassigning 5 here to the DS side.
Right.
So I just wanted to,
We don't know.
But that's what the complaint from the administration was. And actually yesterday, when they spoke to us, I would have expected that the administration would have had a better handle on what the positions that were being moved. It was hard to tell from what they were saying. I don't think they understood what.
but I think the administration supports the addition of 10 positions in Dale, primarily the
Yes.
oversight of long-term care.
Yes.
That question of whether or not the balance between long-term care and DS is needed is.
Yes. That's what
And
we
it
have
sounds
to
like
get
your
down.
question is more on, does even the long-term care side need that much before you even talk about
And I'm
the
not
DS
saying
side?
I'm not saying they don't need it. I'm just saying, can we,
Is that the first priority of funding?
can we give so much on that side when we're, but.
Yeah, isn't this gonna put more work and demands on the providers? If you've got 10 more people or 5 more people out there checking on them and making sure everything is just so,
You
it's
know,
gonna
it-
put a bigger load on the providers.
Well,
Well,
it
it
looks to me like what they did is split up in terms of, we've got long-term care, which is more our nursing homes, res care facilities. And then we want to have and split them in half and use the other to provide oversight.
But I do think the question of the day really is, do we, would you just give a 3% increase to residential care homes? And would you, with the crisis that is going on at adult days, would you put your money into, but
Do we put money into regulation or do we put money into shoring up the services
Yeah.
that directly are providing care to this population?
Yes,
That
right.
is, that is,
that's the basic
that's
question.
what we're really,
And that's, that's the struggle.
And they're putting money into the bureaucracy.
Yeah, instead of in the
And then
care.
we're questioning whether, with limited resources,
Well,
whether we
They,
should.
they did do 3%, the question will be in 7, but then, what I asked about yesterday, and what we need a point of putting language in is, they've done nothing for those families in Berry and Rutland and Oxbow that are now, without, adult days.
Well, that's true.
But
That's
the
a
lowest paid workers are those that work with the developmental disability folks. Some of those that are asked to be either foster families for those with developmental disabilities or asked to work in the group homes that the designated agencies run, at least in my area. Those are some of the lowest paid workers.
I thought we did an increase, so they were all getting $15 an hour back. Remember when we worked with Mary Moulton to get
I know we tried to step to 14.
14, maybe it's, we only got up to 14. It created a lot of compression because then there were a lot of people that, were.
Homes is offering $20 an hour.
And Alice mentioned the ski areas are paying $20 an hour and, where would you like to,
Yeah.
would you like to earn $20
The
there?
Vale
Or,
Free
areas.
skiing.
or,
Vale areas.
or $12 an hour providing direct care.
Oh, in the lift center.
All right, so I guess that's on your list, Senator Westman.
Yeah, I know it is. I've been working on it.
All right,
Right.
so,
Gain more days
335 corrections unexpended funds.
That's
That's,
kind of a normal thing.
that's normal to allow them to move. Okay. That's sort of like carry forward form of the budget. This shall include the total amount proposed for justice reinvestment. That was added.
Yeah, that's putting a corral around the out-of-state beds, I believe.
Well, this just says it doesn't really.
Just says that the market is coming from justice reinvestment.
So but up above on page 63 at the bottom of 63 says no transfer shall be made from correctional services out-of-state beds. I assume that means that anything from savings from out-of-state beds will go into justice reinvestment, but maybe it needs to be clearer.
Making corrections.
Does all that ESSER stuff, I hope that aligns with that bill that we passed out of the Senate using ESSER money.
Sarah Clark is working with AOE because they have some suggested changes to this ESSER 3. Believe the money that we directed was ESSER 2 money, but we're making sure that's the case.
Okay, I just wondered, I don't want to be spending it twice. Page 63.
What,
If we're still on 52,
Dick is on 63.
his document, if I send him an electronic version, that might not be my page number aligning, so go by section numbers.
Go by section numbers, Dick.
So the E335 and E335.1. 335.1 is a statutory change to the form of the budget statute in 32-307. That we should probably take a look at what the underlying statute looks like. Can you pull up on statutes, Chrissy, 32-307, section 307?
Yeah, you bet.
I want to understand what A through E are, if this is similar in nature to the other form of the budget requests.
Do I have to water?
Yes.
I don't think this is specific to DOC. I think this is specific to how And we may want to move the intent of F into a different correction-specific directive.
One of the things we talked about, Dick, in terms of justice reinvestment initiatives, well, I don't know if we call them initiatives, but, and that is recognizing the need to maybe put some money on the front end because we're talking about justice, the whole diversion and justice centers.
Yep.
Should we identify
We should
that?
add that as an E.
It does say a description of any other, not described, but I didn't know if we wanted to be.
I think we should actually do that because they are keeping people out of jail, and that's
Yeah, they
part of the
really
reason.
are. To me, that's kind of the front end of justice reinvestment, and that is what we can do to prevent incarceration. So, do you know what I'm talking about, Stephanie? On page 53, add an E so that a specified use of those reinvestment funds would be for the diversion and front end, the programs that divert individuals from.
Community justice centers.
Yeah,
And
Justice centers, diversion, and
the,
other pretrial programs.
It just seems like it's good to identify them as a permissible use.
Yeah.
Because to me, it's just as important that we have those systems in place, and they've been pretty successful, I would say.
Without them, we'd have a lot more people in jail. Or a lot more people going through the court system.
Well, that's true. Are there, looking at the statute, we had language specifically that put a fence around those justice reinvestment funds?
I believe we've had it in session law. We don't know that we have it in statute.
Yeah, it was in the Budget Adjustment Act, so I think we should just take that language and put it in here.
So I don't know if folks want to look at the form of statutes. So it's A is the budget shall be arranged and classified as to show separately the following estimates and recommendations. And so the A, it's, expenses, deficiencies, bonded debt loan. B, the budget shall also include detailed definitive recommendations of the government relative to the amounts that should be appropriated to each of the activities. So sources of receipts and interdepartmental transfers, changes in positions. C is the budget shall include a strategic plan for each state agency. D is the governor's budget shall include an annual budget for Medicaid and all other healthcare assistance programs. And then E is the budget shall include any proposed expenditures for enterprise and internal service funds. And then F would be the justice too, and I don't know if that's exactly the place you want it, perhaps, like, maybe it is, but.
It doesn't seem like it. We don't have that same language with choices for care. Remember when we,
have the total
shifting the
Medicaid
balance,
picture, yeah,
Um,
of Medicaid mentioned in the form of the budget, but, so I just,
We'll put that in.
I imagine it was a recommendation from the folks that are on the Justice Reinvestment 2 side of the House. And maybe,
Dick, do you have a thought about that? I mean, you've seen what the A through E does. This just doesn't seem to fit very well. Shall include the amount requested for any proposed expenditures. I mean, we don't. The budget includes a whole lot of requests, and we'd have a long list, we'd be through the alphabet twice. If it said the budget shall also include the total amount requested for. It seems like the language that puts a fence around it in terms of its use, which is similar to what we did for choices for care, which is what we kind of modeled it on.
It's very specific to DOC here, as opposed to some of them are, across several departments.
I know.
So it may be something that we want to think about logic, if the idea of it, maybe this isn't the right place to lodge it, but somewhere in DOC is the right
It
place to lodge
seems like it. I don't have any question that we need to do it. We want to put a fence around it. We were really concerned that money be there to support these investments. So
Well, it would be like, I think we've written it before, and so it would be fairly easy to write it again.
let's just say this isn't the right place. I think it does belong. It really is more of an instruction around a particular
It's
a department and appropriation.
It has very specific program,
Yeah.
set of programs in the department, as opposed to the
You
broad.
could simply say any savings in the out-of-state bed will go to justice reinvestment to related spending items.
And that you would probably want to be very clear up in the E335 at the close of 23, which we have done in the past.
Yeah,
It's not quite constructed that way this year from the House.
well, can we do it that way?
Yeah, we will.
Okay.
Yeah.
Because this just doesn't seem to, okay.
I think it builds that fence, and which was the problem in budget adjustment where they had taken savings from out-of-state beds and put them elsewhere.
I think they were using what for administration or something. I can't
Or just to
remember.
balance the budget, you know, between across the entire.
All right, so we'll just, we'll add an E and then we'll rewrite, F will be, rewritten and put into the Department of Corrections section.
And it may even go more with where they're setting it up, the next E335 too. Maybe more
Yeah.
in that part of the strategy more perhaps.
All right, so shall we go to the bottom of page 53, correctional services? That's pilot to Newport and Springfield.
Give them the money.
Okay, so E345, I think we're just gonna delete that because that.
You have that in another.
We have it in a separate bill. So that's quite a bit here that we're deleting.
All the 69 of my version.
You're at labor?
Yeah,
Where-
labor.
We
Mike?
E400,
I have different page numbers than you have for some reason.
but we're, as long as you're in section E400,
Yep, that's where I am.
this is just all, you know, we don't need it because we passed a separate bill.
400 or the other?
No, about the Green Mountain Care Board and the, yeah. E400, now the Department of Labor says that there's a real problem that the House took out 500,000 more than can be taken out to operate their system. Who has Department of Labor?
I think that's me.
I'm finding it somewhere. So,
So like an outline.
Let's just double check that.
Oh, I want to know who gave me a bar of soap and whether it's a message.
are you clean up?
Clean up my act. It looks nice. It's, where have you been all my life? Wake up. It's a wake up. Wake skin up.
Wake skin up.
Yeah, with the scent of freshly brewed coffee.
Oh my gosh.
It's a Senator Scott.
No, I don't.
Oh, where's my
Thank you.
My
Bobby has hers out.
audience is out? Okay.
You've got food.
Who's got labor?
Sure.
Ash.
Oh, you got
You
it.
got an old one.
That's an old one.
I'm looking at mine too.
They used to post it up there.
Used to be on the board.
Yeah. Something.
Labor used to be McCormick,
Well, I think,
but who took, which one took McCormick's place? Bruce
Well, we,
or back?
We danced a little.
yeah, we
Ash's place.
switched. So yours sounds a little more.
Oh, Baruth, I was wrong. You do have it.
oh, all right, Senator Baru.
Yeah, love that.
So, we got a communication from Commissioner Harrington that that the House had taken out more money from their request than they could absorb. And you've seen that,
I
right,
have seen
Stephanie?
that.
And they need 500,000.
That
In
is,
other words, they need 15 or 1.5?
No, this
No.
doesn't refer to the current year budget. This section 400 simply refers to last year's ARPA money that we gave them, or it might have been switched.
I'm moving ahead to
Yeah.
the.
So we would come across this issue of the 500 in the base reduction when we go through the web report.
Yeah.
But there's no language around it. It's simply a reduction in.
Oh, okay. Oh, there's no language then, okay.
It is
So you don't, you
the
can.
pieces
divide
of this is simply authorization to use money that we gave them last year in a
All right.
certain way.
Okay, so, that's just technical then. Oh, this is,
I'm just gonna give you guys a.
And we may want, I mean, this is, we may want to move this to the C section and make it effective on past, since this refers to last year's money.
but that's technical.
Yes, we'll add a circlet to that.
Okay. Oh, E400.1, this is reporting to everybody.
I cracked down.
I apologize, did you close out E400?
If we closed out, we may want to move that to C. I'm just gonna double check
Okay.
on that, just because it's referring to last year's money. We may want it effective on passage. That's the only thing I can think of that might,
Thank you, I'll just leave it
Change it.
open.
or we don't move it at all and make it effective on passage. That's the other option.
All this. The technology modernization. In consultation with joint fiscal office, submit a written report regarding statutes and mechanisms, establish funding for UI information technology modernization. How much of this is left after we?
So this is trying to have information from other states.
I know.
in their modernization effort.
I
and look at
know.
How they've.
The Office of Ledge Counsel may consult.
So the first, sub A is council consulting with us, and looking at other state statutes
This is an
regarding,
assignment for the legislative staff.
this is Damien basically. And us consulting with us, in terms of,
I
funding
see-
sources might not just be in statute in other states, they might be in session law in other states, type of thing. And then B is on the department itself. If we find mechanisms that should come.
It looks like people were looking for that, that silver bullet out there, that there's some magical funding.
They did it the right way,
Yeah,
we should
that
do
the
it that
state
way
has
too.
found. But how does this fit relative to what we put into IT for UI already? Haven't we started a little bit of the modernization for UI? Or no?
So the big chunk of money, I mean, we put a little bit of money up front in the IT section last year. The bigger amount of money you will see when we get to the G section. It is the $30 million, $30.1 million is in that IT section out of ARPA funding in the House proposed budget. The governor had it in general fund.
My question is, why are we doing all this if we've already appropriated the money? Isn't this to find a funding source? But is the IT gonna cost more than 30 million?
It may, I think,
Well, this seems to be out of sequence. This is what you would do before you decided you needed to appropriate, I don't know. So what?
What's the role of the Department of Labor? They're working with these systems. I know they know we have a problem here. And whatever they put together as a plan, we're gonna have to, as a legislature, fund. getting competing funding sources and all of that, generally a department makes a recommendation.
And they've done the legwork to see what
And
happens.
they've done the legwork to see where does their job begin and end, and where does ours?
But the whole thing is a report may include an evaluation of one or more potential funding mechanisms. Well, if we're already appropriating $30 million, my question is, why are we looking for money if we're appropriating it?
And-
Or is
yeah.
it because it's gonna cost more than the 30 million?
I don't put the answer to that, I mean, it's also, you also have the IT special fund that's being set up in here.
Well, we haven't set it up. Yeah,
No, you haven't put, you know, how that mechanism. Like.
How much more than the 30 million is the system gonna cost?
Yeah, they're acting like. we
We're
need to
starting from
begin a-
scratch.
Yeah, a search for mechanisms to fund it, but it's underway. Well, this goes
Or
back
is
to.
it, I'll ask, but if it's concerned about after you have the initial stand-up, the maintenance, does it get borne by the UI or does it have? You know,
all right, so that established fund, you can't, I don't think, can you? The federal rules are really very strict on what, you can't use the trust fund, I don't think.
to maintain them.
No. It's so, that established
Or maybe
funding
you-
for,
You can do surcharges that are outside the trust fund to fund things.
that's broader than the modernization, that has to do with the overall administration.
I will find out, what.
I think I know who wrote, probably. Okay, I think I guess we're struggling with, why would be searching for money when we're appropriating $30 million is really the question. Can the 30 million get appropriated to ADS? And I think we really need to see
And
that.
we need a written report. I mean, I feel as though in each of these cases, the language acts as though you can't ask them to come in and describe to you their efforts, as opposed to assigning them a report that will be submitted, which we will respond to by asking them to come in.
Yeah, we could say we, include in your budget submission
Yeah.
or something.
Yeah.
Report, so.
It's kind of hard for me to believe that when you're gonna be asking for money to do this, that they wouldn't.
That they wouldn't provide all of this.
Yes,
Well, we like to be over directive, don't you know?
I'm just saying.
We love reports. No, some of us don't like reports. And some of it is just sort of assuming that work that should be done normally as a matter of practice, we need to instruct them to do it.
Right, right.
Okay, well, we're gonna take a little look at that, Senator Booth, put that on your
That's on
list
my
of pending issues. All right, 500. K through 12.
K through 12, this is it every year, there's a certain amount of global commitment that is on the special ed Medicaid side that,
Physician claims
Yeah.
medical necessity. Okay. All right. Finding it, what is all this?
this is the shared school district data management system.
Oh, no, is this, no,
That's not, it's different than the chart of accounts.
yeah, I was gonna say,
And it's pushing out the dates and changing what would be put in statute previously as something called, in session law called e-finance plus to this shared school district data management system. Renaming.
Have you had any reports from any of the school districts in regards to 273 shutting down? That's the aid for kids that are having issues in schools. And the new waiting
Yes.
formula not kicking in.
you're talking about the block grants for special education.
Right, that's one thing.
Well,
But I thought House Ed was taking testimony on that right from early on about whether they put a pause, but yes,
Yeah,
that,
but they haven't, I haven't seen anything come through with a pause in it, so the two dates line up, and we ought to See-
they're pushing out the pause date
For this,
for this.
Bobby's talking about the,
He's talking
the
about
block
the block grant that,
Oh,
because schools are saying that they're,
They're gonna be short a
they're
year
gonna
or
be,
2
that's right,
years.
we've been hearing it from
because
some,
the pandemic screwed up their ADM basically. But, I mean, we've already delayed it, I think, 2 or 3 times.
and I
Well,
understood the
because we
reason
didn't
we
have to
switched to
wait.
a block grant was to get rid of that the financial incentive to categorize kids
So, yeah.
as needing special education.
But
So,
Brian,
I'm not necessarily opposed to extending it again, but we have extended it at least once because of the pandemic and at least once pre-pandemic.
it ends up like this year and the waiting system kicks in, but.
Well, the waiting system-
No,
Yeah.
waiting's different.
That's in trouble with.
This is legislation we passed relative to how we fund special
They're trying
ed.
to kill it, yeah.
So then there won't be anything.
Well, if, I hate to say it, but it looks like their bill scraps the waiting system altogether and goes to,
Over here
in Ways and Means. It goes to a
on the north side.
cost equity.
Cost equity.
And that's gonna wind up obviously in a conference committee, but it's hard to see how you reconcile those two.
But the small schools that are,
Well, you and I are on the same page about it, but
Yeah.
it's, Janet Ansel doesn't, and Scott Beck, I believe, really don't like the,
that cousin ain't poor schools, but he's from St. Johnsbury City or town.
Well, I don't know, that it seemed like the study committee spent a lot of time on that,
Yeah,
cost equity.
but, I mean, you know, how, when it enters Ways and Means over there, it's its own
That, I mean, it's
situation.
our little school district.
But you got two things at work, one of which is block granting the special ed, which you did several years ago,
Yeah.
right? That's what I've been hearing from the superintendents are causing a problem now.
But they haven't gone to it yet, so it can't be
No,
causing.
they haven't gone through.
They might be worried that it will cause a
Well,
problem.
that's what we paused until
Yeah.
it turns on for this year.
I think that's what they're
FY
concerned about,
23.
yeah.
See,
In
we
this,
may still have to do that another year if these guys don't.
well, that was a different piece of legislation than the waiting that we just barely passed.
Well, waiting was supposed to take care of that issue, so it could go away. But the dates don't line up. You got one date starting,
Mm.
and this date here is all over with.
Well, there are two different funding streams, so,
Mhm.
but if we're gonna pause it for another reason, it'll line it up anyway, so maybe that's better. So,
Well, I don't know.
I don't know what action, Kate Webb was taking testimony way back in January, February on it. So I don't know what action has been taken on the House side. But she was aware of it and a number of the superintendents came up to testify
yeah,
what the impact would be.
Yeah.
So that was,
But it's a good thing. I mean,
But
we
this-
ought to keep that in the back of our minds that we may have to bail this all out, getting Brian Campion and somebody.
well, they need to give us a recommendation, but I don't,
I told him also about the PCBs, we needed something from them. You know, he's talking about.
using.
Yeah.
Reserving some of the money for PCB.
And I said, we don't wanna work without a recommendation from them, some language from them, so.
But that was in a different.
Yeah.
No, that's in the yield bill.
Which PCB money?
What the House did in the yield bill is reserve the money for school lunches. The possibility of universal meals, and the committee is saying that money that they've reserved and what's in the yield bill should be used to deal with schools that kids are at risk as opposed to going
What
to.
our committee is saying.
Yeah.
Yeah.
So
Okay,
that's in the yield bill.
that's another interesting part,
Um,
food or PCBs.
Well-
Part of that money is set aside for the lunch.
Well, the lunch product carries a $34 million annual price tag.
I thought they took 29 and set it aside.
Well, once again, it's a matter of choices. Do you want kids in a poisoned school building, or do you want to feed, you know, higher income kids? They aren't the hungry kids, because they're already getting free and reduced hot lunches. It's just to give them to everybody. So it comes with a high price tag.
Eric always had to earn his own hot lunch money. I wouldn't.
So
That's why you keep pushing for universal school lunches.
Just to get rid of your
Because you can
guilty
feed your own
conscience.
kid.
yeah, I'm sure Eric was hungry.
Well, I guess.
Yeah, and you and
I think Eric's doing just fine with he got his own company.
I'm sure his mother didn't even care enough to pack a lunch if he needed it.
I was already, I'd been to work for hours before he ever went to school.
Well, we need to get back to, this
Yeah,
is just technical, right?
Yeah, but it is a combination of both the district management system and the finance system. They're meant to be parallels with this.
That finance system, we were getting hair on fire reports from the managers 3 years ago. So I don't know what the state.
Where it, they did extend again the charter of accounts.
Yeah, you see this, so there's the shared school district financial data management
Yeah.
system, that's E 500.1.
Through 5.
And then everything is paused until July 1st, 2023.
So where are they pausing the chart of accounts?
I think they're pushing out to December, actually, no later than December 31st, 2024, all Vermont supervisory union districts. That's the change from 2022 to 2024, I think, impacts the financial data minutes, the chart of accounts.
That's part of it too.
Yeah. But the pause is until 2023. The year from this July.
How many years ago did Martha Heath leave?
5.
6.
2 years in Mitzi, 4 years in Kitty, and almost 8 years ago.
Oh, really?
Oh,
yeah.
Uh-huh.
And that was
So-
what her last year
Yeah.
was when we set aside the money,
That's
and
right.
then they took several years to decide how they would do the
And
money.
our former colleague, Senator Ash, said we fought World War I, we fought World War II, we fought the Korean War.
Before we got the chart.
And and that took less time than getting the uniform chart of accounts. And so now we're gonna probably add the Afghan War. And
That was
That was
Burt
16
was
years old.
CFO for the agency.
so if Senator Ash, former Senator Ash is listening to this, I'm sure we'll get an email. All right, so I guess this is just moving it out.
All of these are related to the combined data management and financial.
All right.
It's all big movement, but let's see what on the top, page 62.
Yeah.
Well, we do have a report. Apparently, we haven't done anything for 5 years.
Where is that?
That's what's on the top of page 62.
62. Shall jointly submit a report.
And a recommendation of whether to discontinue the implementation. Interesting.
But that is coming up short. The report is coming up soon, December 2022.
Right, but I mean, that language suggests that we would be
86 in the whole thing.
up for considering just Xing out of it.
So all the time and effort that's gone into the chart, the common chart of accounts could possibly be
And money.
discontinued
And money.
and money. So we have district data management system. Is that different than the financial system? Would that be grades? Would that be other student information? What is the school district? Do you know, Phil? What is in that data management system, and is it fiscal as well?
I'm
Is it-
wondering, is this the system that produces the checks? You know, that cuts the checks for people and processes their hours and.
No, I think that's like the payroll systems for this, but
No, I don't.
no,
That's-
this is,
Phil, rather than our sitting here kind of speculating,
All right,
if you could give us a little background on
Sure.
exactly what we're doing here. What is the school district data management system? Is the common chart of accounts a part of that management system?
yeah,
Are they actually suggesting that we to continue or discontinue? That would suggest that it's really riddled with problems.
right.
to
Well,
even-
it sounds like they're setting up to get a recommendation to do away.
and in 501, they're keeping the mandate, they're just pushing it out to 2024 on the very clearly the financial chart of accounts piece of it.
Wait a minute, 501?
E 500.1, sorry, which is on page 60. So that's the mandate that they all had to have the same financial chart of account system by the end of this year, and that's being pushed out 2 years. But
That shouldn't have been either, because it's a nightmare with them school districts all using different.
Yeah,
Well, it means you don't have consistent statewide data to make policy decisions.
yeah. And I mean, we don't have that many districts anymore.
They should all have the same one. Way back when I was in there.
But it's all under the heading of shared school district financial data management systems.
So, well, shared school district data management system is every other place but the mandate to have the same financial system is.
Yeah, it's separate.
Is separate.
Well, if we could find out what the other is and make sure that no way that we're just giving them more time, but we're not just proposing to discontinue the common chart of accounts, that would help. All right, so now we're on to 500 ethnic and social equity standards advisory working group.
And that's just pushing the data.
Yeah, okay, cease to
Hi,
exist.
bud.
What?
Hi.
Dick, well, you had a comment?
I think he's frozen.
Oh. He's frozen.
Yeah, this working group, the last I heard, they had staffed up and they were working, but clearly they want another year of.
What number is that?
It's
That's on
on page
page
62, way down the bottom, 500.6. So all of that is the working group, just changing the dates. All right, so now we're up to 501, and this is after 3 parts.
And the agency has let us know that they may have changes to how the dollars distribute here, and we're making sure that they are consistent with what we have in the other bill,
Yeah, okay.
and don't conflict with that.
All right, so that
So-
may possibly, the figures might change based on AOE
Yeah.
review.
So, Stephanie, on 64, midway down the page. Seed grants to districts for adoption of 21st century quality approaches without necessarily having to meet the usual 21st century stringent grant criteria, with targeting to districts that have been challenged to stand up 21st century. Is that supposed to mean that have found it challenging to stand up 21st century programs? Or that they have been somehow targeted and challenged to stand up those programs due to their geographic challenges? Just a badly written sentence, number one, but it's not clear to me.
From the Agency of Education, it's a badly written.
Yeah. Well, it's not clear to me whether it's saying that you don't have to meet the usual standards because some of you are challenged by your geography. or whether this is accurate and they mean they have been challenged or solicited to stand up a program. And we're adding to that.
Sarah Brewer, that's on your list.
Actually, it is Becca, but I will take it on because she's
Becca's education?
Becca's education K through 12.
Oh,
But that's all right, I'll deal with it.
oh,
But it's an interesting question.
yeah.
We may have a complete, I know Sarah's meeting with the AOE folks today, so we may have a different
Okay, well then hold that,
recommendation.
Bill, until we get, all right, 502. Special ed formula grants. This is from the ed fund?
This is from the Ed Fund. And these are, I think, the statewide programs, and they usually count under the whole 60% target. I don't know if that target has changed under the new special ed.
What are we notwithstanding there? What's 2969 C?
And 67B, 2 through C and D.
206, you're gonna spend 4 million.
Oh, I bring mine.
Apparently there's limits to that.
16. 16.
Yeah. You shall not be limited by the restrictions within 16 VSA, I don't know. This must be something AOE requested, or, I mean, it's pretty arcane.
It's, I think, before we switching to the block grant, it was written in a slightly different way, but I'm pretty sure it's the total of statewide programs that we're referencing here. 1629.
But it's for funding for 16 VSEA, section 2967 B. 6. So it's out of the special ed appropriation.
2967
B.
B.
So
Total expenditures
No.
made by the state in any fiscal year pursuant to this chapter shall be 60% of the statewide total special education expenditures. Cost of funds that are not derived from federal sources, special education expenditures shall include costs eligible for grants and reimbursements under 2961.
What's C and D?
What's C and D?
2969 C and D.
2969 C and D.
That's what's being done.
The purpose of meeting the needs of students with emotional behavioral problems, it's fiscal year, that's, this is C. Each fiscal year, the secretary shall use for training, program development, and building school and regional capacity up to 1% of state funds appropriated under this subchapter.
So it's gonna allow more than 1%?
Um,
Is that what we're saying?
In distributing such funds, the secretary shall not be limited by the restrictions contained in C and D. And for training of teachers, administrators, and other personnel.
Look, if Sarah is talking to them about the ESSER, could you talk to them about this as well?
Yeah. So C is the 1% for emotional behavioral problems, is the training, and they're both about training. And the D is for training of teachers, administrators, and other personnel in the identification, evaluation, and provision of education services to children who require educational supports shall use up to 0.75% of the state funds.
So it sounds like it's freeing him up to spend more, no?
You shall not be
So
limited
these-
by the restrictions,
Yeah,
so.
so the
I mean, I would be all for allowing additional,
but it's only the it's the 4 million that can be above the.
Yeah.
And the 4 million is for the, I just have, cost for the cost for services to persons who are visually impaired, cost for the interdisciplinary team program, cost for regional specialists and multiple disabilities, funds for training and programs to meet the needs of students, and then it refers back to 2969C and 2969D.
Okay, so it's basically saying out of that 4 million, in fact, you aren't gonna be within those allowed uses. You don't have to deal if those limitations,
But those, the amounts under those limited places are part of the 4 million as well. It's what it's kind of feeling like.
but you can't exceed the 4 million.
Well, the 4 million is the identified amount out of the total special ed grant line.
Right, but in distributing the funds for the reasons that purposes you and.
It seems like it's just trying to get rid of those 1%
Percentages.
0.7.
Yeah. I think so.
And that would make sense because post pandemic, they have, what do they call it? Compensatory services to provide, and they probably have lost some of their aides in the shortage.
Is this,
They're probably looking to train up more people.
is this language new this year?
I think the way it's written is new this year because we're changing the special, we're turning on the special ed change. But I think we've always had these statewide programs identified as being part of the 60% statewide total. I don't, the last phrase of the, notwithstanding the distributed part of the restrictions on the 1% and 0.75%, I don't know. I can go look at last year's bill and see if it was in there, but I don't know if it was or not.
I was just thinking that if in fact, this is fairly routine, we ought to go in and take a look at, but that would be education to look at that statute, because it could be those limitations just don't make sense anymore.
Yeah.
The reason we used to have it in was to make it clear that it was part of these statewide program training pieces count in the 60% total. It's the notwithstanding, I think, that is new.
All right, so we'll just keep that because we.
It looks okay to me.
And then flexible pathways.
This we're gonna change a little bit based on the public funds bill that we passed that has the dual enrollment impact.
75,000.
Maybe 75 on the ed fund side and 75 on the,
But we're gonna,
so both,
you'll have to do both here.
sub 1 and sub C will both change by 75. D sub
Yeah.
1 and sub C.
Okay. So we'll have the 75K to the general fund C. Add 75 to 1. All right, assuming that bill gets passed by the House. Has it been passed yet?
I don't know that it's passed by the House, but we passed it in the Senate, so our portion of it will.
I know we will, but I just wonder.
Whether it stays is a question of whether it passes.
All right, so this is the retirement, and this is the normal contribution, and this is consistent with the treasurer's letter. And this is dealing with the normal contribution. The healthcare, that's nice to see.
So does any of this change given the,
No, this is to reflect the agreement.
so this all reflects the.
This reflects the ADEC payment for teachers in 514 for 2023, reflecting the estimates that are related to the agreement in 2023. And the same thing down in 515 is the new ADEC, because we're pre-funding OPEB for teachers. We used to do pay-go here. The 515 is very different than the language that came over from the governor on this, because it was just the pay-go amount. And so what we're showing here is the total ADEC amount for our new pre-funded OPEB system. And we're referencing both the money that we're funding in the base and the $5 million extra that's in the 1100 C.2. So that the total picture of the ADEC is there for the OPEB piece. But there was a small change. The estimate is down on the normal contribution is down because of the contribution, the first year of contributions from the teachers. That's assuming a July turn-on date. And the accrued liability is down a little bit from the current estimate on the change in the COLA up above. So these numbers change to reflect the agreement, even though the House hasn't passed the bill yet. So you don't need to change these numbers. So make them really fast.
I got it. So should we call this the Kitchell Teachers Retirement Health Care Fund?
Yes.
Right.
I think on the floor, when you make that amendment, that's our.
There's your tiers. That's a nice card.
It's a wonderful card.
It is not tears.
It's as close as they come to tears.
Since often. Should have been tears.
It's as close as they come to tears.
I know, but it's not even from my committee. I have to get my recognition externally.
Wow, that was neat.
It's fine.
The
Thank
end
you.
of the year, we might do something, but not before we get escaping out the door.
I know. Well-
Including but not limited.
$1 and the other valuable considerations. All right, let's go on to higher ed. And so University of Vermont, this is standard language about app score. Is that still the same amount or did that get changed at all?
I think that's changed.
And then Vermont State Colleges. This is how we pay them.
I always like this shall issue bonds.
Where's the line for the dollar for the first?
Sounds like they're coming for.
Oh,
That's just the info section. This is the B section, this is the Morgan horse farm.
Because I know that-
It's in there.
Yeah, the one bucket for the Morgan Morgan.
That's the most important.
And this is-
Can I cut that to 50 cents?
No.
And then we have VMAC that
When it comes to more.
goes to state colleges. All right, so that's standard. We'll close those out. 603,
603 is out.
oh, this is,
And
and
then,
this is our commitment.
yeah, this is the investment that still remains in global commitment because it's the allied health piece of this.
But there's the commitment that if this goes
If it did go away.
they're made whole.
They're not, yeah, but holding the bag.
And then VSAC.
Yeah, the first one is that fostered. It's got a name.
Yeah.
Emily, I think Emily's. Something like that. This fostered children's scholarship piece. B is the amount that they can take up to for admin. C is the for staff expenses.
Administering the funds.
So how much? So B is how much they have to do in direct student aid, which leaves 7% for non-direct student aid of the total one-time. So this would refer to the 802 opportunity, which is the only one-time funds that would have come in this act to BSAC. So they could use $100,000 of the 802 opportunity.
And what is the 802? How much
That's
is that?
that's buying up the income level for
No.
the free CCB tuition from $50,000 to $70,000.
My question is 100,000 against what?
Oh, 1.5.
Thank you. So it's less than 10%.
What we're missing here under DSAC is the normal dual enrollment piece.
Yeah.
And then obviously we have.
You mean in terms of the book supplies that,
Yeah,
and the
that's
student
missing, we
support?
need to add it. And then depending on where the Senate lands on the total workforce picture, how the language around what flows through these act, if anything, needs some, if you stayed with what the House did, I think we need to amend it, but I think we'll revisit that when you have the picture of your workforce investments.
Yeah. That's coming right along.
Senate Economic Development is working on it, I think.
Liability insurance contract.
That seems like a name change.
Well, no, the agency shall retain for its use 7,000 for the administration of what's the program?
Statewide
ATV
ATV
trail program. Is that just a simple like Wild Valley Rail Trail?
No,
No.
that's AOT.
Oh, that's all AOT.
Yeah, rail,
Oh,
rail beds. For the administration of this program, what is the program?
It's the liability insurance
Yeah.
for our trails.
I think that, yeah,
So
because
fee
we do
85%.
cover it, so landowners are willing to let their,
Oh, yeah,
land
that's
used.
right.
Yeah.
Landowner fire.
For trail liability insurance.
Yeah.
And to contract with law enforcement services, with any constable, sheriff's department and municipal, because we do provide.
This is under the fees and penalties. It's allocated. The fees and penalties collected. Is that collected by DMV?
So we have to look under the 23 VSA is where.
Well, basically, it's saying that they can get some money to administer the program.
Which is everything, the maintenance and the trail liability insurance and the law enforcement. So it's all three of those things. And
It costs about $200 to register a snow machine.
But those things cost how much in the beginning?
What's it cost to register a snow machine?
Over $200.
Are you sure isn't some of that the trail maintenance, the TMA?
Yeah, your TMA costs.
Yeah, well, that,
your
TMA is trail maintenance, the registration though
membership,
is.
To, your club membership, so you can ride on bass trails. If you just want to ride on your own, it doesn't cost you anything.
No, but the registration per se
Wow.
is what, not $36 or
Yeah,
something?
something like that, but then with the two other charges and then,
It's
you
a
have
user
to-
fee, isn't it?
Pardon?
It's a user fee, trail user fee.
Yes.
Yeah, it's
This
a
is-
trail, it's like
this
a
is
road.
ATVs.
I know, VASA. Uh-huh.
But if you did that with cars, you guys in transportation gain quite a lot of money.
Well,
Well, we got the gas tax.
we do get,
Right.
which is
They
declining.
pay the gas tax.
I'm gonna suggest we give them some money to
And
administer that.
we take the sales,
Fill the tank with one something.
the
So,
sales on
Really?
cars, we send it
I
as
don't
well.
know about these more.
Cars? Oh, sales tax. What does VASA stand for? Vermont Association of SA, CSA.
Vermont
Sportsman's
ATV
Association.
Sportsman
Oh,
Association.
sports, right at the top.
Yeah,
Top one.
Vermont, it's Vermont V, A is for ATV, S is for sportsman.
It's right on the
Oh, I
top.
see, I see.
Thousands and.
Yeah, I see. I got a couple of-
It costs you like $20. One day, one afternoon, one day. And snowmobiling is, high rent
Where are these trails?
business.
Yeah, where are these trails? Are they all over the state?
Oh, yeah.
Yeah, they
All
are.
over the state. They have good trails too.
I have to tell you, C, we've been having some discussion around the wisdom of $3 million to go to state parks and fishing access areas. Yeah,
Where's, what page is
and
that?
transportation, it's on page 72, particularly fishing access areas.
Do they need?
Well, that was the question about making the investment there. The other thing is.
These are for, are these,
Are these all general fund?
And well, fishing access areas are a problem. It says areas available to the public. But fishing access areas under the Dingle whatever act,
Yeah.
federal act,
They get money for that.
they get money for the fishing access
Right.
areas. And I think that there's an issue around, because we had that years ago where remember Canoe Company was, and people were parking in the fishing areas and they were not,
They don't pay.
and they don't pay. And so I think, so I just want to let you know, we probably need to take a look at all
I
of
think Anthea
this.
sent that around. I think Anthea sent a note about that
Yeah.
a week or so ago.
Getting rid of the word fishing, so it would be state parks and
Anthea, the
access.
drafter on transportation
Oh,
issues.
we still need to,
And this whole section will have to be reconciled to what Senate Transportation decides.
Mhm.
But all the EV pieces are now in general fund. And when the appropriation is actually in the big bill, in the G600, the climate section. They just cross-reference because they're also projects, I guess, in the white book or something.
yeah.
Well, there aren't.
So how do you pay for that? What, is there a meter on
On what?
the charger?
Yeah, there are companies that you can, if you want to, for example, allow them to use lease space, like in, I guess, park and rides or whatever, and like Charge Point, there are companies where you actually pay to charge.
via your phone with an app?
Yeah,
Okay.
and
Why are we
Or
paying
a credit card.
You're paying the customers.
this
I
is,
think we're paying to install.
Paying to install them.
And then, like you have parking meters that the city installs, and then they bring in an app, and the app runs the electronic funds that are moving through it, but the city owns the infrastructure. The parking meter, in this case, the state would own the charging station.
Just like at the park and rides.
And you have to bring the power over to where you're gonna put the
and
charging
the big
station.
thing is about level 3.
Yeah. the good
Um,
ones.
The fast charge, you actually have to have 3-phase power. So in a rural area, a lot of these fishing access areas are, in fact, there's not power. But, so it runs, I just want to let you know this needs some work in terms of, we're discussing it in terms of, and I don't know, is this where they made the? No. Then there was the other issue around,
There should be.
there were 2 other areas where transportation is taking a look, and that was, the governor's budget had $1 million for e-bike incentives. And some e-bikes are very expensive, and apparently Senator Chittenden bought one for like $300 or something,
Mhm.
280, so we give a
I think-
$200
The state's got these goals.
incentive,
Move
but,
to
so
right?
we have
So this
50,000
helps
now,
with
and
the
that
state's
was $1 million,
statutory
and the other was $1 million
where
for
we should get
Electric ATVs and snow machines.
electric.
app. They should cut the state in for a certain amount of money. That should
No,
be the general.
and the House, there were 2 related
That's modest.
issues, one of which is you're getting maybe emails. VAST got $1 million, they wanted $1 million for groomers
But just.
and
say-
50,000 for law enforcement. That was in the governor's proposed. The House did not give anything for the VAST request, but they did keep the $1 million for, it's called e-recreation, snow machines and ATVs.
No, it's obvious. It's still-
which we're
You know,
suggesting
you
may
can't
not.
reliably
The
drive
technology
across
is very
the
new,
country.
and
You
if
gotta
you're gonna
spend
do
a
that,
lot
why
of
not
time making
both,
sure
electric
you plan your
boats, but we didn't get into that. And the question is really, should that $1 million go? We're getting the requests from the public utilities around, you know, the metering and so forth.
Yeah, and how would
Is the
you,
money better spent
you
to
look
build
that
that
up?
infrastructure to support the electrification? So I just want to let you know that I don't think our transportation committee feels that they would like to give subsidies, as somebody dubbed it, for fun. When there's so many other needs that are out there for general fund. So, and if you were gonna give more money, would it make more sense to give fuel efficient cars to working families to get to a job 12 months as opposed to, but there's obviously manufacturers of these ATVs and snow machines would support getting a subsidy to support their new technology.
I can't imagine where that is.
Can you imagine explaining that to a constituent, Bobby?
No.
There's so few
They
people
should.
out of the general population that are using those.
If I went to the snowmobile club and told them that, they'd probably.
So
really
I just
like
want to
that.
let you know that those decisions made by the House that tie into transportation.
Yeah, so are the state parks moving into because of these charging stations, moving into the transportation budget?
No, these are all paid for in the general fund. They were proposed to be paid for with ARPA dollars, but it's turning out that these particular investments aren't ARPA eligible. And so in the House bill, we just see them in the general fund when we get to the G sections, which will go through tomorrow. That's
car chargers, it,
And it's now using,
fishing accesses?
well, I just told you that the committee doesn't really think that that is a good location. And because when people are out for the day and you're charging, you first of all, how many charging stations would you have? And they're tying up there's a lot of complications in these rural
Tying
areas.
up to getting in, to taking your boat in and out of the water, if a bunch of cars are parked out.
I don't
Who
think-
would go there? Are people who aren't even fishing. They go there.
They can't because of the Dingle
Dingle Johnson.
Yes.
Or Dingles.
So I just want to alert you that there's discussion about those related recommendations. And maybe you felt differently when it was ARPA, but now, which the governor only wanted to use for transformative activities, it's hard to understand. The argument is that that would help support travel and tourism. But those incentives would be paid to Vermonters who we don't tend to think of as tourists, but I suppose you could say stay vacations would come under that. But that was the connection, was that those investments would support travel and tourism.
Well, and the state parks at night, when it says state parks also on my
No,
position.
I'm just talking about the EV incentive,
I know, but it says here EVs at state parks.
but I'm sorry, Alice, I was talking about the subsidies to give Vermonters
Oh, yeah.
so they could go buy an electric ATV or snow
Yeah.
machine.
I think you could get away with an electric motorcycle.
maybe, because then you could say, I'm using it to
Well,
replace my car.
In the summer,
Yeah.
you could at least go the maximum distance that it's rated for, but on a snow machine, can you imagine how your mileage would get cut down from in the cold weather? Battery doesn't.
Well, not only that, usually the trails are only open, what, 2.5 months?
Yeah.
Yeah, so, and I don't think many people are using their ATV to get to work. But the argument was that this would support travel and tourism.
What we should do is connect it with programs to incentivize people to move here, so we pay their moving expenses, we buy them a snow machine.
Yeah.
And then.
And they move here on a snow machine?
Sounds good.
Actually, when you talk to these companies, and we heard from Beta Technology, and Scott Beck was talking this morning about it, someone in St. Johnsbury area, what they're finding is the housing is their biggest problem. And so Beta Technologies, I think, requires some housing so
they've got a place to stay until they can get housing. It's all over, so.
I think, Stephanie, we've gotten through this.
Yeah, we can start on the G sections tomorrow, because that's a lot of language to read through, but that's stepping into the money.
No, Bobby's
But
saying
it's probably a good thing to walk through and
And
understand.
at this
Well,
point, it's
he
4:30,
just said
so I'm gonna adjourn